In the heart of Yorkshire,
Hello, Emergency Department.
an unbeatable team.
That way.
And stop, we're going to lay you down.
Hard at work 24 hours a day,
Does it count as a daily exercise?
7 days a week.
I can smell it now. It's a really bad burn.
Saving lives,
It might be that we need to put you to sleep in order to try and sort this out.
helping loved ones,
It's a shocker, that.
making the community they serve better.
We got you, lad.
You're being such a good boy.
A health service treating anyone
Car door, house door.
Van door.
Big van door.
It's quite impressive, isn't it?
and everyone.
Oh, you're going to have a good black eye.
Are you a doctor?
A team doing anything and everything for each other.
It's just been mental down here. I will do it. I'll get to it.
We're strong people in Barnsley, you know.
This is Barnsley Casualty 24/7.
You're absolutely all diamonds. Brilliant.
We fixed him.
On shift tonight, Dr. Phil Taylor.
Going to see a massive kidney with a massive stone.
An 87-year-old is being blue lighted in.
Straight into resus then, please.
He's struggling to breathe. Dr. Phil Taylor prepares base C in resus with student Dr. Ewan.
Your chap sat on the toilet today, couldn't get up. He's alert, but has got a low blood pressure. I was thinking most likely probably chest infection. That's plasma. Could be a bit of heart failure, but you try not to form too much of a picture really, because anything can walk through the door. Probably all infection driven. But they've not been able to cannulate him. Sounds like this is him. 1, 2, 3. Okay, if I sit you up a touch.
Yeah.
Make you a bit more comfy.
Thank you.
Is that all right? My name's Phil. I'm one of the doctors. I'm going to be looking after you today, all right? I thought he looked quite unwell. He came in looking very pale and was quite breathless. His heart tracing showed that he had an irregular heart rhythm. This one looks quite regular, but this one looks a lot more irregular, doesn't it?
We've had 4.
Yeah. His heart rate was going a lot faster than usual, and that can be driven faster by, say, an infection.
We've given him a nebuliser for his chest, just to see if that's going to help him. And his stats got to 86.
Yeah, you're a little bit cold, aren't you?
And that's... Oh, this is Ralph.
All right.
Ralph has come in with a complex set of health issues.
So just been generally unwell the last few days.
For a month.
For a month, all right.
Any movement,
Yeah.
and I've been out of breath.
Any movement whatsoever?
Yeah.
All right. Have you had any chest pain at all?
No.
When there's this many conditions going on, you do have to be quite careful and think quite carefully because you potentially can make the situation worse. Right, just going to try and get a cannula.
Dr. Taylor wants to run a series of blood tests.
Your blood's definitely taking its time to come out.
Yeah.
You get this a lot in the elderly population. Their veins are quite snaky, they break down very easily, and so they don't have as good flow in them. Right, I'm going to have another pop at the other side, I'm afraid.
Right, okay.
Oh, I can see a good vein on this arm.
Right.
Should have started with that one, shouldn't we? Well, that was a much easier cannula. Just going to get one more sample, sorry. 1, 2, 3. So we're going to send off some blood tests. We're going to get you a chest X-ray.
Right.
So I'll just get all that sorted.
Ralph is very unwell and can't leave resus.
Right, you actually take some big deep breaths in and out, please.
Dr. Taylor and his team will need to closely monitor him.
Ralph, right, just have a quick listen again.
Back in resus, Dr. Taylor is continuing to monitor Ralph, who has low blood pressure and is struggling to breathe. Daughter Janet is by his side.
Can I get you to sit up for me? Good man. All right. Nice deep breaths, as deep as you can.
In addition to his current symptoms, Ralph suffers with a long-term health condition, which leaves his heart weak.
Again, it's entirely possible that the heart failure is contributing to his breathlessness. So as the heart gets more tired, it pumps less efficiently and fluid can collect in the lungs. All right, well done, you can lie down. You can definitely die from fluid collecting on the lungs. And usually if someone has a history of heart failure and they're breathless, you would have that in the back of your mind as a potential diagnosis.
Dr. Taylor needs to treat Ralph for possible fluid on his lungs.
You've got low pressure there.
Has he? In patients who have low blood pressure, you're in a constant balancing act between increasing their blood pressure by giving them fluid, but also not giving them so much fluid that their heart can't cope with it, because then all this fluid builds up in their lungs. His chest sounds pretty clear. I'm going to start this fluid, actually. If someone's blood pressure on the low side, it means not enough oxygen gets to the brain, and so that was the most pressing thing to solve, really. Right, just going to give you a trickle of fluid, all right, because your blood pressure's a tad low. Do you feel dizzy or anything? Do you feel dizzy or lightheaded?
Yeah.
A little bit dizzy.
Treating his low blood pressure by giving Ralph fluids could flood his lungs. The next few minutes will be crucial.
Thank you, bye.
In Resus Base C, Dr. Taylor is treating Ralph, who has a wide range of complex medical conditions.
Hold on.
Thank you.
So we've given you a shot of antibiotics to cover you for any chest infection. The X-ray team are going to come around and get you a chest X-ray, because it could be that you've got fluid on the lungs.
He's very ill, so the radiographers come to him.
See, we do an X-ray on your chest, all right? Okay. That's it, sweetheart. Sit back on the chair. Just relax your shoulder down. Pop your arms down by your side, Tommy. Breathe in, hold it there. Breathe away.
Let's wrap you up.
Ralph's struggling to control his temperature, so it's difficult to monitor his SATs.
The way that the oxygen probes work is they attach usually to your fingers or your toes. If patients are really cold, the body's way of naturally dealing with that is to close off all the blood vessels that go into your peripheries. So if it's going to read a falsely low oxygen tracing.
But Nurse Amy has a solution.
It's a hot water bottle. It's a makeshift hot water bottle. It's just hot water in a glove. I told you my water bottles work. You got warmer hands than me now.
I don't think so.
You do? They're lovely and warm. Hey. We have some sats, Bill.
Brilliant. What do you reckon?
And now the X-ray results have arrived too.
We're going to have to be careful with this fluid, because this line here basically means that there's fluid in the horizontal fissure. So that suggests that he's got fluid on his lungs. He's also just got probably a bit of infection, so there's quite a lot going on. Yeah.
With so much fluid on his lungs, Dr. Taylor must reduce the saline level going through his drip.
Can we just give this slow in like a bag of just 50 mils of saline or something?
Ralph is critically ill. But Dr. Taylor and his team are doing everything they can. Back in Resus, Ralph is struggling to breathe. He's got fluid on his lungs, and his blood pressure is dangerously low.
His bloods have actually just come back this moment, so he's got an HB of 56 confirmed on his full blood count.
HB, or hemoglobin, is found in your blood. It carries oxygen to the heart and the brain.
When his blood tests came back, his hemoglobin was quite profoundly low. It was about 50. Usually, a healthy person would have a blood count of, say, 120 to 130, 140. So his was well under half of what it should be.
The blood tests also found a high level of urea.
Brilliant, thanks very much. Urea gets raised when blood gets broken down by the body, and that would happen when you bleed into your stomach or into part of your intestines.
The results of the blood tests all point to one thing. Ralph has internal bleeding.
His bleed is more than likely what we call a chronic bleed, so it's a small trickling bleed that has been going on for months. His body has slowly been able to accommodate to this to a degree, and it's then got to a point where his blood pressure has started dropping and he's started becoming unwell.
Ralph needs an urgent blood transfusion.
I think the real thing that's going to make you feel better is getting some blood into you. All right, that's the thing that's really driving everything at the moment. So what I'm going to do is we're going to transfuse you 2 units of blood.
Right.
All right. You've got more blood pumping around your body, you can clear toxins, you can deliver more oxygen, and it just improves the situation in all ways. Hi there, can you put me through to blood bank, please?
The blood transfusion may stabilise Ralph's condition, but medics need to urgently find out where his internal bleed is coming from and stop it. Ralph is about to undergo a blood transfusion.
Right, sweetie pie, I've got some lovely blood products for you, which is nice and cold, so I'm glad we've warmed you up first.
The core of the resuscitation room is to stabilise an unwell patient.
You see it running?
Giving him blood is a stopgap because ultimately you need to find where he's bleeding from. We're going to give you this bag of blood, all right, and then given your blood pressure's come up a bit, we're going to get you up to the medical ward and they're going to give you the second bag up there, all right?
All right.
That's what we've done in his case. We've made his blood pressure better, we've given him some blood, and then we'll send him onto the ward and he'll have further investigation and find out the cause of the bleeding and stop it.
The transfusion has an immediate effect.
Good job. Your colour already looks better. Yeah. Fantastic. Good stuff, all right. Glad you're feeling a bit better. I imagine you'll be in for a few days. It may be that they have a discussion with you about doing a camera test to see if there is a small bleed somewhere. All right.
I wasn't happy about that one, but
Yeah.
I was sat on the toilet when this problem was starting.
Yeah.
So it's not
All right.
very good down there.
All right, so we'll give you this bag of blood and then we'll get you up to medical ward. All right? But nice to meet you and all the best. All right.
Ralph is moved to the acute ward, where he will get a second bag of blood. Further investigations revealed the bleed was coming from his kidneys. He spent 14 nights in hospital. Juggling a busy day, Dr. Phil Taylor is now in cubicle 7 with Pew, who has back pain.
So it's happened last week, but this week it's last 2 days.
Okay.
And it's getting worse now.
So just running through a few other things. Have you been sick at all?
Not sick, but it's kind of like
You
ringing-
feel nauseous. Okay. All right.
Pew has a history of back pain.
So it was about 2 years ago you had this back pain, and you had a CT scan at the time, didn't you?
Yes.
I had a look on your scan. You did show that there was a little bit of pressure backing up into the kidney, which usually means that there has been a blockage further down.
Dr. Taylor has a hunch that he knows what it is.
Are you all right to jump up on the bed and have a quick feel of the back?
Yeah, sure.
Kidney stones are a solid collection of usually calcium, and they form these distinct stones that get trapped in the tube that connects the kidneys to the bladder. Because of this blockage, all the fluid that's coming out of the kidneys can't go anywhere because the stone is acting like a dam, and that pressure builds up and goes back into the kidneys and makes it swell. I'm just going to feel through to the back, and it's mainly on this right side. Sorry, your right side.
Dr. Taylor examines Pew to feel if there is any swelling of her kidneys.
I'll try and be gentle. Is that sore up in there? All right. And any pain when I'm pressing above the bladder there? No? Okay. All right. If you sit yourself up for me. What we'll do is I'll get you some good painkillers. I'll wait for your blood tests to come back. Got any questions? No.
As long as I got a painkiller.
Yeah, we'll get you pain control, don't worry, Emily, all right? Kidney stones are probably one of the most painful presentations that we see, and they're often writhing around in really significant pain.
While she waits, her blood tests are back.
Her bloods are all completely fine, CRP and infected markers are fine.
Pugh is still in agony, so Dr. Taylor orders an urgent CT scan. In reception, Pugh's back pain is increasing.
CT, KUB.
She's been for a CT scan of her kidneys.
Here's her 2 kidneys. This one has this big swelling on the outside of it that it doesn't have here. You can see a massive kidney with a massive stone. And this big thing is a stone, and that's blocking all the urine from flowing out of the kidney and produces this big swelling, which is why she's so sore.
Pugh's pain is now so bad, she leaves the waiting room to find Dr. Taylor.
Hello, my dear. Is your pain really, really bad? All right. Let me just find you a cubicle. Take a seat or lie on the bed, whichever you'd prefer. Here we go. So, just a bit of an update. So, your CT scan has shown that you've got a kidney stone. And like last time 2 years ago, the kidney has swollen because of all the fluid in there, okay? The treatment of kidney stones, they can either pass by themselves, which is probably the more common scenario. So patients will get this pain and then the body will basically squeeze this stone out. If they're larger and they're creating significant blockage, they sometimes need to be surgically removed.
The pain isn't coming up here now.
Yeah. So what's happening is the tube that the stone is stuck in is trying to squeeze against the stone, which is why it's getting really sore. We're going to get you some anti-sickness, and we're going to get you some good painkillers. We're going to get you some IV morphine, all right?
Hello, I'm Ellie. I'm one of the nurses. Have you had morphine before?
Yes.
You have. Might make you feel like you've had a couple of beers or a few gins.
Well, I don't want to be a real gin.
So we give morphine quite slowly because obviously it can make you feel a little bit funny. Might take a couple of seconds to kick in. Feel okay? Feel better? Yeah? You can feel it working?
It's a bit, but it's here that's really bad.
Yeah?
Pugh's admitted to a ward where her pain can be carefully monitored and treated. She stayed for 2 nights before being transferred to Sheffield, where she had surgery to remove the kidney stone. In Bay 3, 75-year-old Alan has been rushed into resus. With him, his wife Judith. He has severe breathing problems and suspected chronic laryngitis. Dr. Phil Taylor is in charge of his treatment.
Hello there, sir. Is that Alan? Hello there. My name's Phil. I'm one of the doctors. So what's brought you in today, then?
I came in by taxi this morning because a fortnight ago, just over a fortnight ago, I had the same bad breathing. I couldn't breathe so well, and worked on me and brought that down. And there was a slight COVID infection. And then when I was released home, he had advised me if he comes back again.
All right. And I was having a little look at your notes earlier, and you got laryngitis, isn't it? And
Yes.
you were in about 2 weeks ago
That's
with,
right, yes.
with COVID.
Yes.
And that's kind of kicked it all off a
That's
bit.
right, yes.
All righty.
It'd be frightening as well.
Yeah, I bet.
When you can't breathe.
Yeah.
Yes.
And prior to you having COVID, what was your breathing like normally? Was it this raspy?
No.
No?
But I had difficulty at times,
Okay.
with my breathing.
All right.
But
And then since you were discharged, have you had any symptoms like productive cough?
Oh, yes.
Yeah?
Yes.
All right. And what colour is it when it's coming up?
Dark, creamy coloured.
Okay. So what we're going to do, I had a look at your previous treatments that you had with the ear, nose and throat doctors last time. I'm going to give you that same set, so some nebulised adrenaline, some antibiotics, and then the ENT doctors are going to come and see you in the resus here now. All righty.
Thank you, Doctor, yes.
Have you got any questions?
No, none at all.
No?
Quite happy.
Thank you. All right, we'll get you a treatment so we'll get you feeling a bit better. All right?
Lovely, thank you.
Alan's already had a chest x-ray, which he'll soon get the results for. So while he waits for the ear, nose and throat doctor, Nurse Amy arrives with a nebulizer to try and stabilise his breathing.
Right, Ellen, my love. You've had adrenaline nebulizers before, haven't you, darling?
Yes.
Just tell me your full name and your date of birth.
1948.
You cheated then, you looked at it.
Oh, did I?
I'll let you off.
We've given Alan a nebulizer because from the bedside I could hear that he was wheezing. So what that means is some of his airways are narrowed compared to normal. And so you can give him medication called salbutamol, which helps open up these airways and hopefully should increase the ease of his breathing.
You're not allergic to anything, are you, love?
No, not really.
Fabulous. Do you want to pop that mask on? You know how it goes, don't you? Nice and tight for your face. We'll just tighten it a little bit. Is that all right?
Yeah, perfect. Thank you.
Fabulous.
With the narrowing of Alan's airways, less oxygen is likely to be flowing around his body.
Gonna pop your antibiotic in, all right, so
Yeah.
So it's essential they widen them before his oxygen levels become dangerously low. 75-year-old Alan is still in resus with wife Judith. He arrived this morning with severe breathing difficulties.
We only live down the road, and we just got rang to get a taxi to the hospital. And with my breathing problem, which was quite difficult, I got a special process straight so into Casualty.
do you want to pop that mask on?
You know?
You know how it goes, don't you?
Thank you.
Fabulous.
Dr. Taylor's put Alan on a nebulizer with antibiotics to ease his symptoms.
You get nauseous. You're tense. Your arms look tense.
Oh, hello there. Speak the devil.
Ear, nose and throat doctor Emilio Giannotti arrives to assess him.
Will you with me again?
Yes, again.
Good. Well, we're going to do exactly the same we did last time. We're going to have a look at your vocal cords, go down with the camera,
Okay,
and see how it looks like, okay?
Yeah, that's fine by me.
Good.
Thank you.
In Alan's case, we know that he has this condition, chronic laryngitis, so that is the most likely cause of his worsening symptoms. However, looking into the throat and into the nose will also look for other potential causes. So he could have inhaled something that's got stuck. He could potentially have a growth that's forming there and is blocking his airway. So the camera will help rule these things out.
You already know how this goes. It's basically the camera through the nose. You're going to have a look
Yes,
at your voice box again, see how it looks.
See, it's still there again. Yeah.
So if you want me to stop, you just tell me. I'll take this all out immediately. Can I ask you to stick your tongue out for me? Give me a good ee. Lovely. Puff your cheeks out for me. Lovely. That's it. Relax. And again, give me a good ee. Thank you. It's coming out. That would be all. Thank you very much for that. And sorry for the torture.
That was
all
a
done.
pleasure. Thank you.
It's looking much better than it was compared to the last time I saw you. Not swollen, vocal cords are moving fine, and I can't see any lesions there or anything obstructing the airway, okay?
Yes.
So we're gonna have a chat with the medical doctors and see where we go from there. Good, if you need anything, let us know, we can come anytime. Bye.
With his throat all clear, that's good news for Alan. But until the team find what's causing his breathlessness, he's going nowhere.
It's getting yeah, 2.5 hours. Yeah. It's not too bad really.
Right, who's next?
In the hub, the team are beginning to get the IT crisis under control. Dr. Taylor is looking over 75-year-old Alan's chest X-ray results. After a nasal endoscopy gave the all clear on his throat, will Dr. Taylor be able to locate the problem in his lungs?
So this was his chest X-ray about 2 weeks ago, and this is his chest X-ray today. Here's his heart, and here's his heart, and looking at both lung fields, there's no real focal changes, nothing suggesting any big nasty pneumonia. So, to be honest, this looks the same as it did about 2 weeks ago, but given the history, it sounds like he's got a bit of a chest infection anyway, because he's been coughing up a bit of mucky spit. But yeah, his chest X-ray looks okay today.
Dr. Taylor heads to Resus to tell Alan the news.
Alan, just had a quick look at your chest X-ray, and it looks absolutely fine. Yeah, we compared it to the one you had about 3 weeks ago, and it doesn't look any different, so I don't think there's any big, horrible pneumonia or anything like that. All righty?
Yes.
With no signs of a serious problem, the team feel confident Alan is suffering from a chest infection. A relief for wife of 33 years, Judith.
It is really, but I think he's better now, feeling that he's been attended to.
Marvellous stuff. Protocol, very good, everything 100%.
And Alan is all too familiar with the good care at Barnsley Hospital.
What was it you used to do as a job?
I used to work on the ambulance service.
Did you?
Yeah, 25 years.
Wow. Did you enjoy it?
I certainly did.
I bet you saw some fancy stuff, didn't you?
Well, it was one of those jobs that you had in them times in the 70s. Yeah, you were 1 minute, you was a doctor, then you became a midwife, and then you be a marriage guidance counsellor. You know, you'd got to step into all them jobs.
That's one thing I've not done. I've not delivered a baby.
Delivered a few? I've delivered a few, yeah, about 6, I think, 6 babies.
Wow.
They'll be well grown up now.
Nice. What did you do, my love?
Well, originally, a long time ago, I was a teacher.
What came after originally?
Well, we were both involved in local politics.
Got my photograph on my mobile phone when she was the mayor.
Were you really? When was that?
In mid-90s.
Hey, you've not changed a bit. Oh, wow. I couldn't carry that around my neck. I'd be fidgeting with it.
Alan will be monitored in Resus till the team have a bed ready for him on another ward.
Keep your phone with you. But I'll have to leave it coat here because I don't want to carry it on the boat.
That's right. Because I rolled it up, put it in the drawers.
It's a nice coat, it looks hanging up.
No wardrobes.
Alan, how are you feeling now?
A lot better, thank you.
Yeah? Good stuff. Does the breathing feel any easier at all?
A lot better.
Yeah?
80%.
Good. All right.
Fantastic.
Well, all your numbers are still looking good, so we're really just waiting for a bed on the ward now. All right.
What 6?
You'll be going up to the acute medical unit.
Okay.
Yeah, and you.
Fine.
Brilliant. All right, well, lovely to meet you.
I said thank you.
All right, take care.
Yeah. Nice job.
Alan was moved to the acute medical unit to be monitored, but unexpectedly suffered from further complications. He was moved to intensive care, where he was put into an induced coma for 4 days. He's currently still in hospital, but is set to make a full recovery. The whiteboard is returned to its cupboard.
And we're back in Barnsley next Monday at 9. And if you or someone you know has been affected by what you've seen tonight, organisations offering support can be found at channel5.com/helplines. Sifting through the evidence to unravel a mystery, the coroner establishes a cause of death new on Wednesday at 9. Next tonight, shoplifters stripping the shelves.